as with any medication, there are absolutely side effects. And as with all parts of rheumatoid arthritis, there are extreme variables among patients in regards to the side effects they experience. I'll talk specifically about methotrexate because this is one, per my personal and professional experience, that has a really wide range of side effects. You have some patients for whom they can take methotrexate orally and they don't have any real problems with it and they tolerate it fine. And on the other side of that spectrum, you have those who take it by injection in an attempt to avoid some of the unpleasant side effects, who are so stricken by side effects they have to discontinue treatment. My personal experience was that. I'm not a person who experiences a lot of side effects with medicines. I typically tolerate things extremely well. Methotrexate completely debilitated me. And this was hard for me to deal with because I was hoping it might be kind of a magic bullet, like it is for some people. But I was so stricken by side effects, I could not function in my life. And I stuck with it longer than I probably should have, for two reasons. One, hoping that the side effects would kind of settle down and pass, as can often happen with medications. But the bigger thing was because I had to for insurance guidelines. And that was hard for me to deal with because I felt like money was governing my treatment. And that's a tough thing, I know, for a lot of patients. But that was my side effect experience with methotrexate. It was so bad, my rheumatologist actually just recently listed it as an allergy. I'm just completely intolerant to it. But I have friends with rheumatoid arthritis that take it and they're fine. To pick a middle ground about that medication specifically, you'll hear people describe it as methotrexate flu or a methotrexate hangover. Most common, people will feel kind of nauseous, kind of run down, tired, really tired. Some people are over it in a day or so. Some people aren't. Just a lot of variables, but that's the most common middle ground for that one specifically. The side effects associated with biologic medicines, again, vary widely from person to person. But I think the big issue with that patients look at are the risk factors associated with it, which I suppose can tie into side effects. You're looking at putting yourself at risk for infections, serious infections, not, just a run-of-the-mill sinus infection, although that is associated with it. I don't know a lot of people personally who have severe side effects from biologic medicines. Again, the most common thing that I hear of is kind of a hangover from it. They'll feel tired and run down and kind of need to take a rest day after their day of injection or infusion. And that's the most common thing. In my personal experience, there's a big weighing here. You're looking at side effects versus relief. And for me personally, and I think I can safely speak on behalf of numerous patients that I know, the prospect of relief outweighs the side effects or many of the risk factors, unless a medication is just completely unable to be tolerated, like my experience with methotrexate. I'm fortunate that there are other treatment options, available. I wasn't, I failed on methotrexate, now there's nothing else I can do. And that's a good thing. And even amongst the classes of biologics, there are options for people to try different treatments. And I guess I would encourage patients to try to hang in there for a little bit. A lot of times side effects pass or become more manageable. But when something is just truly not working for you, not agreeing with you, you've got to speak up, advocate for yourself and say, hey, I can't tolerate this med. And that's where it came to for me. My experience, again, this was with methotrexate, was I would inject it on Thursday night, and by mid-afternoon Friday, I would be sick as a dog. This would last from mid-afternoon Friday until I woke up on Monday. I'd no longer be sick, but I'd be a level of exhaustion I can't adequately describe with words. And then it would be Thursday and time for me to inject again. I have a young child. I'm a single mom. I can't check out of my life for multiple days a week. It just wasn't an option. And the nausea and vomiting associated with it for me was so severe, even Zofran and other measures couldn't counteract it. And so in a case like that, a patient really needs to speak up and say, I can't do this. This is not the med for me. There are other options, and it's important to advocate for yourself and pursue that. Like with any medication, there are side effects for some people and aren't for others. And unfortunately, it kind of has to be a trial and error thing.